Welcome to Boston Community Health. I'm Dr. Elias Thorne. According to official federal health data, every 40 seconds, someone faces a sudden vascular event, but a fatal mistake is that most individuals ignore the very first warning signs until it is too late. Let us observe a real-world clinical scenario frequently unfolding inside the emergency department. An older patient arrives complaining of sudden severe nausea, intense vertigo, and a sharp headache of immediate onset. Initially, family members assume it is mere exhaustion or simple fatigue from lack of sleep, but when asked to perform basic physical movement checks, signs of central neurological injury become clearly visible. This specific moment is where the untrained eye gets easily deceived, and delaying the decision to contact emergency services can permanently destroy the patient's opportunity for a complete recovery. The vast majority of these acute neurological emergencies are driven by a sudden arterial blockage from a blood clot. When vital oxygen flow is cut off, millions of brain cells perish every single minute. In geriatric medicine, we emphasize that a stroke is never a random accident, but the final result of chronic arterial narrowing progressing silently over decades. The greatest tragedy occurs when initial signs fade spontaneously within minutes, causing the individual to assume safety, completely unaware that a catastrophic event is preparing to strike the nervous system within hours. To prevent families from remaining defenseless against this threat, International Neurology has developed an emergency identification protocol that is highly memorable, called FST. This protocol acts as a life-saving tool helping you locate vascular risks at home without complex equipment. Before diving into details, take a second to click like, subscribe to Boston Community Health, and comment your city below. The very first letter, F, stands for face, representing physical facial drooping. When you ask the individual to smile widely, observe both corners of the mouth very closely. If one side fails to elevate or shows a distinct lack of symmetry, that represents your first major red flag. This asymmetric drooping occurs because the specific motor cortex controlling facial muscle symmetry is losing vital blood supply due to crossed neurological pathways. When the left hemisphere suffers from lack of oxygen, it immediately manifests as paralysis or sagging of muscles on the right half of the face. This symptom can be accompanied by fluid involuntarily leaking from the corner of the mouth without the patient's awareness. Even if this event lasts for only a few minutes before resolving, your nervous system remains in an emergency state. The second letter in our emergency protocol, A, stands for arm weakness, representing a sudden, unexplained loss of physical motor strength in one upper limb. To evaluate this sign, ask the individual to close their eyes and hold both arms straight out in front of them, palms up, for 10 seconds. In a healthy body, the nervous system maintains this symmetrical posture effortlessly, but if one arm automatically weakens, fails to raise as high as the other, or begins to drift unconsciously downward, that represents clear evidence that the motor signaling pathway from brain to spinal cord is interrupted due to a severe lack of oxygenated blood flow. We must separate this central neurological deficit very clearly from ordinary arm numbness caused by mechanical nerve compression during awkward sleep. Mechanical compression produces a temporary pins and needles sensation that resolves rapidly with simple wrist movement. Conversely, vascular arm weakness occurs even while the individual is resting completely relaxed, with zero physical pressure applied, causing the upper limb to feel incredibly heavy, exactly like an alien object no longer obeying commands from the mind. The third letter, S, represents speech difficulty, meaning sudden, unexplained alterations developing within the individual's ability to produce or comprehend spoken language. The individual suddenly presents slurred speech, unclear pronunciation, or utilizes completely jumbled words despite their conscious awareness of the errors. Another manifestation involves them understanding perfectly but failing to produce words, or hearing your voice as meaningless noise. If you find this helpful for your family, please click like and subscribe right now. This event happens when the middle cerebral artery is obstructed, halting blood supply to Broca's area for speech production and Wernicke's area for language decoding. When circulation to these language sectors is cut off, human communication capabilities break down instantly. This reality leads us to the final and most critical letter of our protocol, T, standing for time to call 911 immediately. Remember clearly, in acute emergency neurology, time is literally measured in brain cells. Every single minute of delay means approximately 2 million neurons will perish permanently due to the complete absence of vital oxygen delivery. Having the patient arrive at the hospital within the first 3 hours from symptom onset completely determines the success or failure of advanced acute medical interventions. When a patient reaches the emergency room during this golden window, staff neurologists immediately perform a brain CT scan to rule out intracranial hemorrhage. If confirmed as an ischemic event caused by clot, they will activate an urgent clinical protocol utilizing targeted intravenous clot-dissolving therapies to break apart the arterial blockage. This specialized hospital process immediately restores critical oxygen distribution, effectively saving vulnerable brain cells that are currently suffocating in the shadow of the obstruction. Alongside the 3 classic pillars of a FAST protocol, actual hospital presentations show many patients experience highly notable ancillary symptoms. First is the appearance of severe nausea and vomiting developing alongside sudden, intense vertigo. The individual experiences the environment spinning violently, rendering them completely unable to maintain balance even while lying still in bed. This mechanism occurs when a blood clot obstructs the vertebral artery system supplying the cerebellum and brainstem at the base of the skull. During the initial clinical examination, physicians always utilize a stethoscope placed against both sides of the neck to screen for a vital medical sign known as a carotid rout. A carotid rout develops when the main blood vessels in the neck become heavily narrowed due to years of cholesterol plaque accumulation. When blood passes through a narrowed arterial segment, it no longer flows smoothly but swirls chaotically, creating a distinctive turbulent sound audible through a stethoscope. The presence of this rout represents clear evidence that the vessel wall is unstable, warning that plaque fragments are at risk of breaking off to travel upward, developing a complete blockage of vital oxygen flow. The actual clinical scenario smoothly transitions into a highly critical lower limb motor evaluation, the bilateral leg elevation test. Staff neurologists inside the emergency room will instruct the patient to lie flat and attempt to lift each leg up to a 45-degree angle. On the unaffected side of the body, the patient's leg will elevate rapidly and maintain its position, but when shifting to the opposite side affected by the vascular event, the patient's lower limb entirely loses motor resistance or falls back down onto the bed immediately. This contralateral lower limb paralysis provides physicians with a precise mapping of the damaged brain tissue. If you find this video helpful for protecting your family, please take a moment to click like, subscribe to Boston Community Health, to leave a comment below sharing your health experiences. Your interaction actively helps the algorithm spread this life-saving video to protect more seniors. The next clinical check is evaluating dynamic ocular movements along specific spatial axes. A physician will instruct the patient to open their eyes wide, hold the head still, and utilize only the eyes to track a moving finger or pen light to the right, to the left, upward, and downward. When blood flow to the oculomotor nerves becomes compromised, the patient's eyes lose their smooth coordination. One eyeball might remain frozen or fail to track fully to a specific corner. This ocular tracking deficit proves that the brainstem or cranial nerve fibers are facing severe mechanical stress from the blockage. Next, a highly distinctive sensory evaluation is performed to the surface pain response diagnosis utilizing a specialized medical tool known as a broken cotton Q-tip. The physician utilizes the sharp and dull ends of the broken cotton swab to gently touch corresponding skin zones across the patient's body, including both hands, both ankles, and symmetrical areas of the face. The patient is asked to close their eyes and identify whether they perceive a sharp or dull sensation, and if the intensity feels equal on both sides. This process helps the neurologist evaluate the degradation of the parietal lobe, the brain's primary center processing physical sensations. The actual results in these acute vascular emergencies routinely reveal a terrifying pattern. The patient completely loses surface pain perception across the entire left half of the body, while responding normally on the right. The individual may perceive basic touch, but the brain lacks the capacity to differentiate between a painful sharp edge and a harmless dull end. Upon completing all physical examination steps and obtaining a brain CT scan confirming the absence of hemorrhage, physicians enter the most decisive phase, a strict medical contraindication screening, before deciding to activate intravenous clot-dissolving therapies. This specialized hospital filtering process demands absolute clinical precision. The physician will intensively ask questions targeting the patient's medical history. Has the patient undergone major surgery within the past 3 months? Have they suffered any severe head injuries recently? Is there any active internal bleeding or gastrointestinal hemorrhage? These queries are not mere administrative paperwork. They represent the boundary protecting the patient's life, because these powerful clinical therapies will systematically dissolve all clots inside the human body. If the patient has an unhealed wound or a hidden gastric ulcer, the medication will rupture the vessel, causing massive bleeding, or most dangerously, a secondary hemorrhagic stroke inside the brain. International clinical statistics demonstrate that fewer than 5% of patients receiving this intravenous clot-dissolving therapy experience intracranial hemorrhage within the acute stroke region. This represents a real and highly significant medical risk. Therefore, your hospital protocols always require family members or the lucid patient to make a critical healthcare decision whether the benefits of restoring motor function and saving brain cells heavily outweigh this 5% risk. Once family members provide definitive consent, the clinical machine immediately activates the emergency infusion process through automated pump systems. But hospital interventions are merely addressing the end-stage crisis. What I need you to remember deeply is how to ensure your family never enters the high-pressure room. Your most effective long-term preventive intervention is strictly managing your underlying risk factors at home. First and foremost being your chronic systemic blood pressure. Chronic high blood pressure stands as the single biggest, most silent driver behind nearly 70% of all ischemic strokes, because it continuously exerts mechanical stress, damaging the delicate arterial lining. When the arterial lining is damaged by high pressure extending from year to year, your body automatically responds by deploying cholesterol molecules and platelets to coat the injury. This automatic mechanical healing process lines the inner vessel walls with dense atherosclerotic plaque. Over time, the circulating space inside the artery becomes narrower and narrower, forcing blood supply to travel through an incredibly fragile opening, setting up a highly unstable state for your central circulation. The second foundational risk factor requiring regular screening after age 60 is hidden atrial fibrillation. Atrial fibrillation prevents the heart's upper chambers from contracting synchronously to eject blood, causing them to quiver chaotically, forcing blood flow to swirl and pool. Within that stagnant blood, large clots develop rapidly. The greatest clinical tragedy is that this condition often manifests as paroxysmal, meaning it occurs for only a few minutes per day and self-resolves completely. A standard 10-second office ECG performed at your doctor's clinic almost never captures these brief anomalies, causing this silent disease to remain completely undiagnosed for years. To eliminate this diagnostic blind spot completely, discuss with your physician about utilizing a continuous 24-hour or 48-hour Holter monitor evaluation at home. This small clip-on device records every single heartbeat across a full day and night, successfully identifying those within paroxysmal episodes. Once identified early, cardiologists can prescribe targeted anticoagulant medications, which systematically reduce your cardiac-related stroke risk by 60 to 70%. Your third core preventive intervention is evaluating your chronic blood glucose status through regular hemoglobin A1C blood tests. This clinical metric reflects a true picture of your average blood sugar control over the past 90 consecutive days, completely different from a standard fasting blood check. Chronic high glucose inside the bloodstream acts exactly like microscopic glass fragments, continuously scratching, eroding, and destroying the smooth arterial endothelium, heavily accelerating dangerous plaque buildup. These three targeted screenings provide a comprehensive clinical shield, helping you manage the top underlying drivers of stroke after age 60. Now, let us focus on your immediate response protocol at home and the common well-intentioned mistakes that can drastically worsen acute brain tissue survival. The first and most dangerous mistake: you must absolutely never drive yourself to the emergency department while experiencing sudden neurological symptoms. Even if your symptoms appear mild or are beginning to resolve on their own, your physical coordination and reaction time are already heavily impaired without your conscious awareness. A few brief seconds of vision loss or dropping arm control while driving at highway speed will instantly become life-threatening for yourself and everyone around you on the road. Call emergency medical services immediately, or have a family member drive you without delay. Establish a concrete response plan with your household today. The second catastrophic mistake is taking blood-thinning medications like aspirin on your own initiative at home. This represents a highly common instinct because people know aspirin saves lives during acute heart attacks. But you must understand clearly a stroke is not biologically the same as a heart attack. Medicine classifies strokes into two major categories with completely opposite mechanisms: ischemic stroke caused by a blocked vessel and hemorrhagic stroke caused by a bleeding vessel inside your brain. Blood thinners like aspirin help during a blockage, but will cause a catastrophic, fatal outcome by accelerating bleeding during a vessel rupture. The only way to differentiate them is an emergency brain CT scan. Therefore, let the medical team make that critical medication call only after structural imaging is complete, while waiting for professional help to arrive. What you must do is focus entirely on proper body positioning. Have the person lie down comfortably with the upper body elevated 15 degrees using a thin pillow, keeping the neck in a neutral position, not sharply tilted forward or thrown back. This position maintains optimal oxygen flow without straining intracranial pressure. Mistake number 3 is exposing the individual to excessive heat, including taking a HealthyAging bath or drinking heated fluids under the false impression that warmth improves vascular circulation. This sudden heat exposure triggers widespread peripheral vasodilation, causing systemic blood pressure to drop sharply within an already unstable circulatory system. This pressure drop immediately reduces vital blood flow to the ischemic brain tissue, expanding the permanent damage zone rapidly. Additionally, ensure you have a written daily medication list prepared for the first responders. Having this paper ready saves precious golden minutes, directly influencing the acute treatment decisions. Let us bring all of today's vital medical insights together into a powerful protective shield. A stroke remains a leading driver of death and long-term disability worldwide, but the vast majority of catastrophic events are entirely preventable if we act correctly during the 24-hour window. You now fully recognize the 7 distinct red flags of one-sided facial drooping, sudden arm weakness at rest, jumbled or missing speech words, temporary vision changes, abrupt loss of balance, a thunderclap headache, and transient one-sided numbness. Memorize the most critical clinical rule in urology. When 2 or more of these distinct warning signs appear together simultaneously within the same window, your risk multiplies exponentially. The pairing of symptoms like arm weakness with slurred speech or vertigo with brief vision dark proves a specific major blood vessel territory is under extreme circulatory stress. The 72-hour window following these temporary warning episodes represents the period where effective stroke prevention medicine happens. When arriving early, doctors perform advanced imaging to locate unstable plaque and measure narrowing, allowing them to intervene before the arterial blockage becomes complete. This represents the golden window that many individuals unfortunately waste due to a false sense of security. I want to leave you with a vital mindset shift. The stroke you successfully prevent does not make dramatic breaking news. It carries no intense resuscitation moments inside an emergency operating room. It remains completely quiet. The beautiful outcome of that wise prevention is just an ordinary morning where your brain stays sharp, your steps remain steady, and you continue having warm conversations with family. Mainstream medicine and clinical research exist entirely to protect the quiet, priceless, ordinary outcome for your life. Write down these 7 warning signs on a paper note or store them inside your phone app. Share this educational video link with the people you care about most: a spouse living alongside you, an aging parent, or a sibling over age 55. The individuals who are at the highest statistical risk of facing this vascular storm will likely never search for these clinical studies online. Your small act of digital sharing today might become the exact reason someone's vascular system is saved from a devastating future paralysis event. Your self-advocacy allows them to preserve their cognitive mind to live an independent, happy life. If any single symptom from today's video matches an experience you have already passed through, do not let another week slip by in silence. Initiate a firm conversation with your physician. I'm Dr. Elias Thorne from the trusted medical organization Boston Community Health. Our professional mission is to deliver honest, international geriatric knowledge without fear-mongering to help you dominate your health destiny. Your brain is a completely priceless and unique asset, deserving your highest level of wise protection daily. Always stay sharp, stay highly informed, and master your own destiny. Please click like and subscribe to Boston Community Health right now and leave a comment below about the warning sign that surprised you most. Wishing you continuous health, longevity, and see you next time.